Menopausal symptoms are something that all women go through, and menopause itself is a period that everyone must pass through in order to step up to the next stage in life. This video is about self-care, how to treat yourself, and the importance for men and healthcare professionals to understand women experiencing this. Good morning, I'm Dr. Mandarin, a general practitioner. This time, I would like to give a complete explanation of the overall picture of menopausal disorder. By watching this video, you'll learn what kinds of symptoms menopausal disorder has, what kinds of treatments are available, whether there might actually be other diseases that are often mistaken for it, and important points to keep in mind during treatment. I would also like to talk about how to think about menopause itself. In fact, there are really a lot of people who are troubled by menopausal symptoms. And you might realize that some symptoms you have are actually due to menopausal disorder, or that these symptoms can actually improve with treatment. Since things like that can happen, I hope this video will help you get a clear understanding of the overall picture of menopausal symptoms. And for men or healthcare professionals watching this video, you might realize that these symptoms were actually due to menopausal disorder, or that this kind of treatment works for these symptoms. By actually understanding these things, I think your perspective and the way you interact with women suffering from menopausal disorder will also change, so I hope you'll watch until the end. On this channel, I share knowledge from the standpoint of a general practitioner to help everyone become healthier starting tomorrow, so I'd appreciate it if you could give a thumbs up and subscribe. Now, let's get into the content. This is a complete explanation of menopausal disorder. There are really a lot of symptoms like sweating, dizziness, palpitations, irritability, and more. As for treatments, here are some options. There are quite a few options such as the Astrana patch, Kampo herbal medicine, or placenta injections. Now let's go through them one by one. First, let's talk about the definition of menopausal disorder. Definitions can often be surprisingly vague, so I'd like to explain it clearly here. The definition of menopausal disorder is the 5 years before and after menopause. So, it usually develops between the ages of 45 and 55. There are individual differences, but as a guideline, it's between 45 and 55. And then female hormones, specifically estrogen. It's a condition where symptoms that interfere with daily life appear due to an imbalance in estrogen. In other words, when daily life is affected, that's what influences our diagnosis of menopausal disorder. So even if symptoms are present, well, if your daily life isn't greatly impacted, these are menopausal symptoms, not a menopausal disorder diagnosis. I've noted something important. It's about more than hormones. Psychological changes from aging matter too. Gradually, as we get older, our mental state also changes. Social factors such as relationships at home or in the workplace are also involved. What this means is, for example, when you reach your 40s or 50s, your children may become adults and independent, leaving you alone. Also, as your parents' generation gradually needs more care, you may become exhausted from taking care of them. There can also be things like late life divorce, and various other factors are involved in the appearance of these menopausal symptoms. So it's not just the influence of female hormones. We also assess possible psychological or social factors. We consider all possible ways to help and provide care accordingly. Around 30% of people experience menopausal symptoms severe enough to think about leaving their jobs. As I mentioned earlier, for women as they age, the hormone estrogen decreases, and it's safe to say that everyone experiences symptoms related to this. About 30% of people consider quitting their jobs because of the severe symptoms of menopause, and out of those, 1/3, in other words, there is data showing that 9% of the total actually end up leaving their jobs. Because these symptoms are severe, coworkers need to be understanding. However, there's little understanding at work, and as noted below, this lack of understanding persists. There is data showing that 40% of people lack understanding of menopause. So when it comes to people who are experiencing the menopausal symptoms I'm about to introduce, there's a lack of understanding, like wondering why that person is so irritable or why they're sweating so much. Because of this lack of understanding, people aren't able to be considerate. Some people quit their jobs due to troublesome menopausal symptoms, so I'll explain these symptoms next. Please listen closely. One thing I want to mention here is that I think a lot of people have a somewhat negative image of the term menopausal disorder itself. The word menopause tends to dominate the conversation, and the word disorder also gives a negative impression, I think. However, the Japanese character in the word for menopause actually means further or change, like in the word modification, so it carries the image of moving on to a new stage. And since this is something all women go through, menopause is actually a process for moving on to the next step in life. I hope you can think of it that way. That's why it's important to be the first to notice changes in yourself, to reconsider how you take care of yourself and how you show yourself compassion. I believe that's what menopause is all about, so I hope those around you can also understand that menopause is a period for moving on to the next step in life. This might be a bit challenging, but I'll explain it thoroughly, so please listen closely. I'll cover the basic mechanism of menopause. Simply put, please look at this diagram. When we talk about menopausal disorders, first, please look at the lower part here. It's a decline in ovarian function. The number of eggs contained in the ovaries is already limited and will never increase, so as you age, they gradually decrease. That's why ovarian function declines over time. When that happens, less and less estrogen is produced. Then there's a part of the brain called the hypothalamus, which acts like a kind of boss. Since the brain is like a boss, it doesn't slack off and keeps sending more commands to produce more estrogen. Actually, this increase in signals from the brain can cause symptoms like irritability and depression. As shown on the left, when female hormones drop, symptoms caused by excessive brain signals are actually due to gonadotropins like LH and FSH. When those hormones increase, it can lead to symptoms like irritability, depression, or feeling down. So, if you wonder why that person is irritable, it's because their brain has increased those hormones. This is clearly a symptom, so it's not that the person who is irritable is at fault, or that there's something wrong with you for feeling irritable. Please remember that it's not about that. So then, what kind of symptoms can appear because of this? This time, I'd like to explain the symptoms by dividing them into 3 categories. The first one is here, vasomotor symptoms. These symptoms are the most well-known and also the most common, I think. The symptom we see most often is actually called a hot flash. Simply put, it's when you feel flushed or overheated and start to sweat. That's what we call a hot flash. This symptom reportedly lasts nearly 10 years, making it tough, realizing that feeling flushed is a menopause symptom. There are many people who don't realize this, so I want you to know that this symptom is often caused by menopause. I want to make sure to tell you that here. Also, there's the feeling of heat and then palpitations. Since these are symptoms related to blood vessels, palpitations are common. Your heart may start pounding faster, and you might also feel dizzy or lightheaded. Those kinds of things can happen too. This symptom called hot flashes is really tough, and even at work, you might wonder why you're feeling this way, even though the air conditioning is on and the office is cool. People may wonder why you're fanning yourself and wiping sweat, thinking you look odd or like you're overheating, and sometimes look at you that way. This symptom is really tough, and I think there are a lot of people who feel embarrassed because of it. The second one is this, psychological and neurological symptoms, in other words, mental symptoms. For example, anxiety, feeling anxious about everything, or feeling down. And then there's irritability. You might get irritated by things easily, even when there's no real reason. You might feel irritable in the morning, for example. Those kinds of symptoms can also happen. And then there's depression, where you feel down and can't seem to shake it off. You lose motivation to do anything, and then there's a sense of fatigue. Even though you just slept and woke up in the morning, your body feels heavy, your legs won't move at all, or you can't get out of bed. On the other hand, you might have trouble sleeping instead. You might feel like you didn't really sleep at all. You might wake up early and struggle to fall back asleep. These symptoms can also occur. At first, many people don't realize these are symptoms of menopause. Don't you think there are a lot of people who don't even realize it? But actually, when we prescribed medication, many people said those symptoms improved. So I hope you'll first recognize these symptoms in yourself and consider trying treatment for menopause. Psychological factors like children leaving home or caring for aging parents also affect the mental symptoms of menopause, so I don't think medication alone will solve everything. I think there are also aspects that aren't so straightforward. The third point is this one. These are symptoms referred to as other physical symptoms. Various symptoms can also appear in the body. The first is joint pain or lower back pain. Some people might be surprised by this, but things like unexplained joint pain all over the body or lower back pain. And numbness in the hands and feet as well. If you feel numbness in your hands or feet, that could actually be a symptom caused by a hormonal imbalance. Urinary symptoms can also appear. Actually, estrogen it's a hormone necessary for creating a feminine body, so when female hormones like this decrease, it can also cause changes in the organs of the female reproductive and urinary systems. As a result, the bladder may lose flexibility or muscle strength, causing frequent urination. The balance of bacteria in the female genital area can change, sometimes causing itching. Also, it's well known that bones gradually weaken around the onset of menopausal symptoms. When estrogen levels drop, its bone strengthening effect is lost, increasing osteoporosis risk as bones weaken, usually starting in the 40s or 50s. Now, finally, what you've all been waiting for. As for the treatment methods, I'd like to briefly explain them. There are 3 main types of treatments. The first is hormone therapy, the second is Kampo therapy, and the third is a treatment called placenta therapy. Now, I'll explain each in detail, starting with their benefits and characteristics. Hormone therapy mainly helps with vasomotor symptoms. After all, vascular symptoms, as I mentioned earlier, symptoms like hot flashes, feeling flushed, and sweating are the most difficult to deal with, so the strength of hormone therapy is that it works well for these kinds of symptoms. It's also said that properly timed and used hormone therapy can reduce the risk of some cancers and vascular problems, which is another benefit. As I mentioned earlier, when hormone levels drop, it can also reduce bone changes and osteoporosis risk. This hormone therapy offers many benefits, and patches or topical medications make it easy to use for those hesitant about oral medicine. So, what are the characteristics and benefits of Kampo medicine? Well, it's exactly this. You can have a customized prescription. With hormone therapy, there can be complicated side effects, which I'll explain next. Kampo medicine tends to have fewer side effects, so I think that's another reason why it's easier to use. We can choose the type of Kampo medicine according to each person's constitution, and if one medicine doesn't work, we can try another one and keep switching. So having options is another advantage of Kampo medicine, I think. And the third one is a placenta injection. This injection works for some people. It's called a mysterious medicine, and it can be effective for all kinds of symptoms. However, for some people, it doesn't work at all. There are also people who don't feel any change at all, so placenta injections are kind of a wild card. It's also a medicine that's often used in the field of beauty, so I think a lot of people are already familiar with it. Now, I'd like to briefly explain the important points for each one. First, the precautions for hormone therapy. This is mainly due to the risk of blood clots, as well as the risk of things like breast cancer and ovarian cancer. I won't go into the details in this video, but the risk of blood clots is always present. However, there is some data showing that when hormones are supplemented through transdermal patches or topical creams, the risk of blood clots is said to be lower. So when undergoing hormone therapy, I think it's a good idea to choose patches or creams. And as for breast cancer and ovarian cancer, there are various theories, but the same goes for breast cancer. Choosing patches or creams reportedly lowers risk, so always follow your doctor's instructions to use them correctly and safely. If you use this hormone therapy properly, there's likely no cause for major concern. Now, regarding the side effects of Kampo therapy, basically, Kampo therapy has very few side effects. There are some quite rare side effects though. Some, like interstitial pneumonia causing lung damage or pseudoaldosteronism raising blood pressure, are rare and complex side effects. There are some side effects, but if used safely under a doctor's guidance, they're minimal. I think this is a benefit of Kampo medicine. However, it can be bitter and must be taken 3 times daily, so it's hard to keep up unless you're diligent. Those are some drawbacks. Lastly, let's talk about placenta, the drawbacks of placenta injections. In terms of side effects, I don't think there are any in particular. Actually, it's just that the protein from the human placenta is broken down into amino acids for injection. You're essentially just injecting amino acids, so there aren't any notable side effects. The only possible issue might be an allergy to a component in the placenta medication. Lastly, I'd like to explain some important points to note about each treatment method. As for the important points to note about hormone therapy, actually, when it's used for menopausal disorders, it's important to start hormone therapy early and treat it properly from the beginning. Using it for about 10 years can raise the risk of cancer and vascular issues. It's said that the risk of blood vessels becoming blocked actually decreases, so generally, it's not recommended to use hormone therapy after the menopausal disorder period. There are also many contraindications. For instance, smoking is one. Since this hormone therapy adds estrogen, it can be risky for hormone-dependent cancers like breast or uterine cancer. Hormone therapy isn't suitable for people with certain cancers, so there are many precautions. That's why it's important to listen carefully to your doctor. One thing to keep in mind about Kampo medicine is that its effects actually work slowly. You might start taking it because your menopausal symptoms are tough, but you may not see results right away. That might happen, but please be patient and keep taking it. Kampo medicine usually starts to work after a few weeks, so first take it properly and then see if you notice any changes. So, since the effect is rather subtle, for those who are currently struggling and have come to the hospital for help, Kampo medicine might not be the best choice. Kampo medicine offers benefits like minimal side effects and easy selection, so keep that in mind. Lastly, here are some precautions about placenta extract. The important thing to note about this placenta extract is that you won't be able to donate blood. Since placenta extract is made from human placental tissue, for safety reasons, you are currently not allowed to donate blood after using it. That's the rule, but since it's not actually a blood transfusion, that doesn't mean it carries transfusion-related risks like HIV, hepatitis B, or hepatitis C. If you ask whether there really is a risk, that's not exactly the case. But just to be safe, you won't be able to donate blood. Also, you should note that you'll need to visit the clinic once a week. Isn't it hard to visit the hospital weekly? If you work, it's tough to keep up unless placenta treatment really helps you. I don't think most people can keep up with this placenta treatment, and also, insurance only covers it for people between 45 and 59 years old. So if it was really effective for you and you want to continue after turning 60, you'll have to pay for it out of pocket. Those are key points about placenta treatment you should know beforehand. Also, since some people develop a menopause-related disorder even before the age of 45, it's important to note that placenta treatment won't be covered by insurance for those individuals either. Alright, this will be the last point, so please make sure to listen to this part. It's extremely important. In order to diagnose menopausal disorder, it has to be a diagnosis of exclusion, so it's crucial to thoroughly rule out the following conditions. These are called differential diagnoses, other conditions to rule out besides menopausal disorder. There are mainly two types of conditions. The first is thyroid disease. The thyroid is an organ about this size, located here. This organ controls things like our metabolism and energy levels. Thyroid hormone helps regulate metabolism and energy. Diseases where the thyroid hormone decreases or increases include Hashimoto's disease and Graves' disease. Hashimoto's disease is a condition where the thyroid function decreases. When the thyroid function goes down, you might experience things like feeling cold, depression, feeling down, or trouble sleeping. Those kinds of symptoms can appear, and don't they seem similar to menopausal symptoms? Also, Hashimoto's disease is more common among middle-aged women. It's important to make sure to rule out Hashimoto's disease. Another condition to consider is Graves' disease. Graves' disease is the opposite, where the thyroid function becomes overactive and increases. Symptoms like palpitations, irritability, and excessive sweating can also appear, which are similar to menopausal symptoms, aren't they? So it's important to check whether Graves' disease is present or not. But it's important to check thyroid function through blood tests, and also by examining and palpating the area. Graves' disease in particular is because it usually develops in younger women, I don't think it's common during menopause, but it's important to rule it out. The second concern is malignant tumors. Above all, it's important to rule out cancer. There are actually 3 reasons why we should rule out cancer, since there are 3 different aspects to consider. For those who visit the clinic with menopausal symptoms, it's important to first undergo cancer screening. What this means is that people in their 40s and 50s are gradually, as cancer risk rises, the government generally recommends screenings like breast and cervical cancer checks, so it's important to get them done properly. And secondly, the symptoms of malignant tumors can be similar to menopausal symptoms. Things like feeling fatigued or sluggish, feeling depressed or down, lacking energy, or even losing your appetite. Because those symptoms resemble menopausal ones, it's important to rule them out correctly. Also, malignant tumors are a concern when considering hormone therapy. Hormone therapy is contraindicated if you have breast cancer or uterine cancer. You won't be able to use it, so it's important to thoroughly check for malignant tumors for that reason as well. Other important things are also listed below, such as depression. Depression can cause low mood and sometimes occurs together with menopausal symptoms, so it's important to carefully check whether it's depression as well. I'll put a detailed video about depression in the description, so if you're interested, please be sure to check it out. And in addition, there are things like insomnia and rare endocrine disorders, such as a disease called adrenal insufficiency, so we also consider whether those might be present. So what did you think? This time, I talked about the symptoms of menopause. I also discussed the pathophysiology and treatment methods. And menopause is something that every woman goes through. It's a period that everyone must experience in order to step up to the next stage in life. This video explains self-care, how to treat yourself, and helps men and healthcare professionals better understand women experiencing this. That's what I wanted to share. For more details on menopause treatments, I'll explain thoroughly on the YouTube Medical University channel for healthcare professionals. The video link will be in the description, so check it out if interested. Now, I'd like to do a quick review at the end. As a typical example, during what age range and for how many years do menopausal symptoms usually occur? Also, what percentage of people did I mention retire due to menopause? I also explained the symptoms of menopause by dividing them into 3 categories. How many symptoms did I say there were in each of the 3 categories? And finally, I also talked about 3 treatment methods for menopausal disorders. What were the specific treatments for each? I mentioned 2 major diseases that need to be distinguished. What were they? If you forgot, please listen again as needed. I hope you will learn from this video. If you found this video helpful, please give it a thumbs up and subscribe to the channel. Thank you for watching.